Introducing the Serengeti Minimally Invasive Retractor System from K2M, a simple approach to complex spine. Place the patient in a prone position, taking care to preserve the sagittal alignment of the spine. Identify anatomic landmarks using standard techniques with fluoroscopic imaging. Use the pedicle access needle to locate the pedicle. With fluoroscopic guidance, advance the pedicle access needle to the desired depth within the vertebral body. After the pedicle access needle is positioned satisfactorily, remove the inner stylet. Insert the guide wire through the pedicle access needle and pass the distal end of the cannula into the vertebral body. Carefully remove the pedicle access needle from the vertebral body and verify the placement of the guide wire has not been compromised. Carefully position the cannulated perfect scalpel over the guide wire and advance to create an incision through the skin and fascia layers. In preparation for tapping the pedicle, assemble the tap sleeve guide into the tap sleeve and advance the assembly over the guide wire into the incision, ensuring a flush position to the bony anatomy. Remove the tap sleeve guide while maintaining downward pressure on the tap sleeve. Prepare the pedicle for screw insertion by advancing the awl tap over the guide wire and into the vertebral body to create a thread pattern. After the pedicle has been prepared, remove the awl tap and tap sleeve and select the proper screw implant. The appropriate implant is then loaded to the polyaxial screw inserter and partially tightened. Insert the screw into the screw alignment guide and fully tighten the polyaxial screw inserter to ensure a straight alignment. The Serengeti retractor is assembled over the screw and attached to the pegs on the blue anti-rotation sleeve of the polyaxial screw inserter. Advance the polyaxial screw inserter over the guide wire and insert the screw into the vertebral body. Once the screw is satisfactorily positioned, remove the guide wire. Kelpie retractors are used to open the Serengeti retractor to allow direct visibility and access to the screw head for rod insertion. Prior to rod insertion, the screw head adjuster can be used to align the screw heads. Select the appropriate rod length and load the hex end into the rod inserter. Secure the rod by fully tightening the dial at the proximal end. Place the rod into the Serengeti retractor at the saddle of the screw and align appropriately for passage to the next screw location. Initiate insertion of the rod by using the tapered tip to penetrate the muscle tissue and advance to the next level. Seat the rod into the saddle of the screws and remove the rod inserter. Remove the Kelpie retractor. Then position the single-action anti-torque rod reducer, the praying mantis, into the Serengeti retractor. Apply a downward force to engage the instrument to the screw head and close the handle to reduce the rod. Attach the ATR set screw to the provisional screwdriver by applying a downward force to engage the hexalobe tip. Pass the provisional screwdriver and set screw through the praying mantis and thread into the implant housing. For final tightening of the set screw, attach the anti-torque handle to the praying mantis and insert the torque limiting driver. Final tightening is accomplished when the torque limiting handle relieves resistance and emits an audible click. After final tightening of the set screw, position the retractor extractor into the Serengeti retractor, ensuring the locating pin is securely placed into the set screw. Engage the top two holes of the Serengeti retractor to the pins on the shaft of the retractor extractor. A rapid closing of the handle will separate the Serengeti retractor at the breakaway features. Repeat this process for each implant. The Serengeti Minimally Invasive Retractor System from K2M, a simple approach to complex spine.